settled. Okay. All right. Good morning, everyone. Thanks to all of you for joining us today. It's an incredibly exciting day for McMaster Children's Hospital and for the children, youth, and the families that we serve across South Central Ontario. I'm Bruce Squires. I'm President at McMaster Children's Hospital and Vice President of Women's and Children's Health at Hamilton Health Sciences. Before we begin, I'd like to take a moment to acknowledge that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. It's my very sincere pleasure to welcome and convey immense gratitude to the Honourable Deputy Premier and Minister of Health, Sylvia Jones, and Nolan Quinn, Parliamentary Assistant to Minister of Children, Community and Social Services. Thank you for visiting us today and sharing an incredible announcement. I'm also very pleased to be joined today by my colleagues, including Keith Monrose, Chair of the Board of Governors, Hamilton Health Sciences, Rob McIsaac, President and CEO of Hamilton Health Sciences, Dr. Angelo Microgenakis, Chair and Chief of Pediatrics here at McMaster Children's, and Sharon Pearson. There's Sharon. HHS COO, Chief Nursing Executive, and Executive Vice President of Clinical Operations. I'd also like to welcome and recognize some of our guests, including the Minister of Tourism, Culture and Sport, Neil Lumsden. There you are. I'd also like to welcome two of our valued local partners. Mario DeVitas, CEO at the Ronald McDonald House, South Central Ontario, and Danielle Zaquette, the CEO of Kemp Care Group, who are such a key partner in our vision, our shared vision, to build a children's hospice here in this region. And finally, I'd like to recognize members of the media and others who've joined us, and particularly the many members of our team, our incredible team who care for kids, youth, and families, and have taken the time to join us today. Every day, children and families from across this region of 2.5 million and growing rely on the specialized services that we provide here at McMaster Children's Hospital, both in this location and at the Ron Joyce Children's Health Center. These are critical healthcare services: pediatric emergency care, intensive care, cancer diagnosis and treatment, child development and rehabilitation, medically complex needs, palliative care, so much more. And as really a top-tier pediatric hospital, you know, we're home to one of Ontario's fastest growing pediatric emergency departments and the largest NICU in all of Canada, which, by the way, is integrated with our comprehensive perinatal and women's health program, making us unique, truly, as a women's and children's hospital. We also house the largest inpatient mental health unit in Ontario, and are home, again, to the Ron Joyce Children's Health Center, offering community-based child development and rehab services, child and youth mental health, and behavioral care. And finally, across McMaster Children's Hospital, we educate the children's health providers of the future. And we have some of the best recognized pediatric researchers in the world. In fact, we're consistently recognized in the top 75 children's hospitals in the world. However, there are still gaps, critical gaps, that hospices, hospitals, children's health services across the province are experiencing. These include significant wait lists and, of course, human health resource staffing challenges. Unfortunately, investment in our services and our infrastructure did not keep up with the growing number of kids. Increasing acuity, particularly that was exacerbated by the pandemic, and increasing needs for more advanced and complex care. Those challenges and essentially undersizing have limited the sector's ability to deliver the care that we all know is possible for children, youth, and families. That's why we're so thrilled to be here today. Without stealing your thunder, Minister, I have it on pretty good authority that you'll be speaking to the historic investments that your government has made to address those gaps and needs. The investment will help grow our hospital capacity so that we can meet the ever-increasing demand for specialized care for children and families. And truthfully, it couldn't have come at a better time. Just 1 year ago, in the heart of the unprecedented viral surge, McMaster Children's Hospital and so many of our partners across the province, we were overwhelmed. We just didn't have the capacity to handle the volume of very sick children and youth. And the result was children waiting often more than 48 hours, in some cases, for an inpatient bed. And the preemptive cancellation of 66% of our scheduled surgeries, which further increased our wait lists and the number of children who had already exceeded the recommended time for their surgery. And there were so many other challenges. Well, again, what a difference a year makes. This year's RSV season has already hit. And over the past few weeks, we've seen dramatic increases in the numbers of patients presenting to our emergency department and those needing to be admitted to hospital. Our teams are, again, having to work incredibly hard. However, understanding that we were getting support, our teams have been working for many months to increase our capacity. We've opened new critical care beds, new inpatient beds. We've created a rapid assessment service in RED. We've opened a same-day overnight surgical unit, just to name a few of the initiatives. And the result has been that we've been able to keep our emergency department flowing far better than last year. Kids don't need to wait so long to be seen, nor to be moved up to our inpatient floors if they require admissions. And we've been able to continue with our scheduled surgical activity, preventing more kids from being added to wait lists and waiting too long for care. No, now, there's still so much more to do. There's more health professionals to be hired, more initiatives to put in place, but we are already seeing benefits. To us, this is more than just a financial investment. This is a monumental transformation in McMaster Children's Hospital. It'll be life-changing for the children, youth, and families of this region now and going forward, for our community as a whole, and certainly for our teams. Minister, thank you for supporting our kids. With that, I'd like now to invite Rob McIsaac, our CEO, to speak, followed by Dr. Microjanakis, and then the Minister. There will also be a questioning period at the end. Thank you very much.
Well, thanks very much, Bruce, and I think Bruce spoke so well. I don't have a ton to add. I did for sure want to issue a very warm welcome once again to Deputy Premier, Minister Jones. It's really always great to have you here at Hamilton Health Sciences, especially on a day as auspicious as this. Parliamentary Assistant Quinn, I think this is your first visit to our hospital, so welcome. It's wonderful to have you. We'd love to get you back and give you a full tour of the premises. Really, as CEO of HHS, I just wanted to say on behalf of our patients, family, workforce, and community, thanks to the Minister for this transformational investment in kids in this region. An investment of this nature will pay dividends for many years going forward as a hospital system that provides care across the whole continuum, not just kids, but all the way through to geriatric care and end-of-life care. We know at Hamilton Health Sciences that healthier kids turn into healthier adults, and so these kinds of investments pay dividends over many, many decades. So it's a very wise investment. It also closes a long-standing gap in care for kids in this region. You know, by most measures, McMaster Children's is the second largest children's hospital here in the province, and I think what the minister is announcing today really is a kind of due recognition for McMaster Children's, the status that it currently has and the function and the role that it plays within our healthcare system. So together we're building, I think, a very strong system of care for adults here in our community. Thank you. I'm going to welcome Dr. Mike Giannakis, our Chief and Chair of Pediatrics. He is going to share a few perspectives from a medical leader.
Thank you, Rob. Thank you, Rob. Thank you, everyone. It's an honor and a privilege to be here with you today. As we come together, I stand before you as a pediatric emergency physician, privileged to care for the children and families in our emergency department from this great city, as well as our entire region that we serve from a pediatric population. I'm also here as the Chief of Pediatrics, responsible for many of the patient care services across McMaster Children's Hospital. From that vantage point, I can tell you that there have been several gaps in our child healthcare system that have been growing over the past many years. And those gaps have had a profound impact on our kids and their families. Every day, I see the lengths that our healthcare team go to deliver extraordinary and exceptional care to those patients and families. I witness it in the emerge department. I see it on the wards. I know it's happening in our clinics and at the Ron Joyce Center and in everything that our people do with care and compassion on a daily basis. We're extremely grateful to this government for responding to those needs by providing this historic investment. We all agree that this support has tremendous potential to bridge the gaps at McMaster Children's Hospital and allow us to provide more care to more kids, consistent with the Hamilton Health Sciences vision of best care for all. Already, we're seeing the direct impact of that investment for our children. It has enabled us to expand our intensive care units capacity and our inpatient capacity by making more beds available to treat our region's most critically ill kids. It's ensuring that every child who visits our emergency department is treated quickly and safely so we can make them better and get them home. Our many ambulatory care services here at the Children's Hospital, as well as at the Ron Joyce Center, can expand to meet the increased needs and complexity of managing complicated medical illness while minimizing admissions to the hospital. And so on behalf of our healthcare team and every family whose lives will be touched by this enhanced care, we offer our sincere gratitude and thank you so much for this monumental investment. Like every winter, we are currently experiencing our viral surge in our emerge department, across our hospital, and across the community. And this is a yearly challenge that our system faces. This historic investment will help our hospital to keep up with the growing needs of our community and is the first step in helping to right-size the child healthcare system for our region. We are in a better position to manage the viral surge this year compared to last year, and again, that is thanks to this government's investment. With that in mind, what are the next steps? What are the other things we need to accomplish to continue on this journey of improvement and meeting the needs of our children and families? Another action that we're working closely with our government to achieve is to ensure that our region and the kids of our region are getting the care that they need we're working to solidify an investment in our alternative funding plan that will allow McMaster Children's Hospital to attract and retain new physicians. With a comprehensive funding plan to invest in anesthesiologists and other specialists, our ability to reduce wait lists for kids in need of pediatric services will be dramatically improved. The plan we are working on with the ministry will allow us to retain and recruit the people we need to realize the full impact of the government's historic investment. With the alternate funding plan in place, we can hire the right people and we can reach our goals so much faster. Once again, on behalf of the children and families who have benefited from this historic investment so far, we thank this government for their foresight and their investment in our future and our children's future. We look forward to continue to work together to right-size our child health care system and to meet all its growing needs. With that, I would like to introduce our next speaker, the Deputy Premier and Minister of Health, Sylvia Jones.
I feel like all the good news has been shared, but I do want, no, it's all good. You know, we need to celebrate successes, and our government has made that investment. But those investments only work, Doctor, when you have leadership, clinicians, team members, volunteers, staff actually doing the work. So thank you for your commitment. On behalf of Premier Ford, it is noticed, it is appreciated, and on behalf of the parents and children in your region, thank you, because you are truly making a difference in the lives of the people that you serve. We often talk about investments as a provincial government, and I'm proud of the pediatric investment that we have been able to do province-wide, $330 million across Ontario. Right here at McMaster, Ron Joyce, we have $330 million that is going to make a difference in your community. What do those changes actually mean? It means that you don't have to wait and have patients waiting in the emergency department. It means that clinicians have the opportunity to seamlessly transfer patients where they need help in different parts of the community. And we'll continue to do that work. We'll continue to expand and increase our health human resources to ensure that we have nurses, physicians, anesthesiologists, respiratory therapists. Everyone who is part of this system, this critical system, has opportunities in community and to be able to work right here. So I just want to thank you for the work that you're doing. Thank you for your leadership. A lot of these investments were discussions and conversations based on what do you need, how can we assist, how can we make your job easier, and so I am particularly proud that we've been able to work with those partners. And with that, I'm happy to turn it over to Parliamentary Assistant Nolan Quinn, who is doing God's work in, I call it MCCSS because I can never remember the acronym, but children and the work that is happening in community is such an important partnership for us in the Ministry of Health. So, Minister.
Good morning. Thank you for that kind introduction, Minister Jones. This is a pleasure to be here today on behalf of my colleague and friend, Michael Parsa, Minister of Children, Community and Social Services. I would like to thank everyone for joining us here today from the City of Hamilton, and a special thanks to the team at Hamilton Health Sciences for hosting us today and their dedication to supporting children and youth and their families. Our government shares your commitment to putting children and youth first to ensure they receive the care they need when they need it. We are making investments that support early needs identification and child and family-centered rehabilitation services, help families cope with their day-to-day challenges, and make access to services more coordinated, more efficient, and more likely to lead to better outcomes. We are continuing to support our most vulnerable children and youth by also investing in modernized facilities at children's treatment centers across Ontario. This past summer, Minister Jones and Minister Parsa announced $330 million in additional funding for pediatric health services to connect children and youth to more convenient and high-quality care close to home at hospitals, clinics, and community-based healthcare settings. As part of that announcement, we included up to $45 million for children's rehabilitation services, such as occupational therapy, physiotherapy, and speech and language services, and post-surgery rehabilitation. There are 7 organizations in Ontario's West region that will be receiving a total of over $5 million this year to help hire and retain more staff and deliver these services. The Ron Joyce Children's Health Centre here at Hamilton Health Sciences is one of the 7 children's treatment centres that will receive funding. This will mean more access to clinical assessments, early intervention, and children's rehabilitation services. It will mean less time waiting for services and quicker recovery and better quality of life for children and their families. We will continue to work with families and sector partners to strengthen and improve services and supports for children and youth with special needs. Together, we will help our children and youth grow into thriving adults in communities across Ontario. Thank you again for your partnership and dedication. Now I invite Minister Jones to return to the podium.
Now, sorry, my own voice scared me. We'll now start to take questions from the media. As a friendly reminder, the format is 1 question and 1 follow-up. If reporters present could kindly form a line behind me, please state your name and your outlet before your question.
Hi, Al Sweeney from CHCH. And maybe Dr. Microgiannakis. How did I do with the pronunciation?
Very well, actually. I will take your questions since you pronounced that.
Thanks. So we're in the RSV season, the viral flu season, or the virus season. Could you outline what is the situation right here now at MAC, what you see happening, and what kind of difference this kind of funding makes?
RSV is not a new virus. This is a typical winter virus that we see every year in Canada and creates a surge of patients, usually younger patients, as it causes some inflammation on their lungs. So our sick patients with other illnesses can be compromised by getting this virus. Young babies have breathing difficulties. So with a lot of children getting sick at the same time, that challenges our system, both on the front lines in the emergency department, to see and assess all the patients, to figure out which ones are coping well and are able to stay home, and if we give advice and support or outpatient treatments that can be managed outside the hospital. But there's also an increased demand inside the hospital for patients that do need to come in for oxygen, for other ailments or flare-ups of their underlying illness and conditions. So all of that causes capacity pressures in order to be able to care for everyone at the same time. This year, with the new investments, with changes in the Emerge department, with a rapid assessment area that can get some of the kids that are well or whose vital signs are more normal, they can be seen quickly and efficiently, allowing our experts in the Emerge department to focus on the kids that are sicker and actually require aggressive treatments and aggressive supports to care for them faster. Our ICU has 4 new beds that gives us increased capacity to care for the children of the region who need respiratory supports. Sometimes the kids need very high oxygen levels. Sometimes they have to go on ventilators and life support to deal with the illness. So we're prepared for all eventualities. This happens every winter. This winter, we're in a better place than we have been in previous years because we have the capacity, we're increasing our staffing, and we're able to support the needs of the community to get through the surge without straining the system as much as it has been in the past.
Okay. So last week, some of your doctors were saying some kids had to be treated in hallways and things like that. How long do you see that going on? How do you see this resolving? And when would you see it resolving?
So just to clarify on those comments, I think they came from the emergency department when there's a large number of patients that need to be seen and the rooms are occupied by other children requiring oxygen and other therapy. We're doing our best to see everyone in as timely a fashion as we can. And for some of those patients, instead of having them wait, it means we're mobilizing every space we can and assessing them in the hallways to make sure we're giving care as much as possible. There's not hallway care going on anywhere else in the hospital. There's capacity, there's beds, there's teams, there's spaces and places. So I just want to be clear what that means, and that it's not misinterpreted from a hallway perspective. Some of our initial assessments are done in the busiest times when we have the most people waiting in the emergency department, but for the most part, we're doing our best to see patients in the appropriate spaces, in the appropriate time, and our new rapid assessment area is helping us achieve that.
All right, we'll be moving to our next question. And not seeing one, that concludes our media availability for today. Thank you everyone for attending.